a spin class in Hamilton, a wedding in Ottawa. Harmless in normal times, but in these COVID times, there are events that led to dozens and dozens of infections. What are superspreaders? With us to explain in the nation's capital, Rewa Dionandan, professor in the Faculty of Health Sciences at the University of Ottawa. And in the East End of Toronto, Ashley Chute, epidemiologist at the University of Toronto's Dalai Lama School of Public Health. Welcome to you both.
Thank you.
And Ashley, I gotta say, I like you already because in the office, we have this East versus West, and anyone who's East is the best. So it's nice to have you on the show.
Awesome.
To get into the conversation, I just wanted us to look at some numbers. Sheldon, if you could, please. In a contact tracing effort involving over 3 million people in India, 8% of patients accounted for 60% of infections, while 70% of the patients infected no one. A study in Hong Kong found about 19% of cases were responsible for 80% of infections, while 69% of cases did not infect another person. And one patient, known as patient 31 in South Korea, infected, get this, more than 5,000 people. Rewa, that is astounding. We are 9 months into the pandemic. What have we learned so far about how this disease spreads?
There's something in the social sciences called the Pareto principle. That's when the majority of consequences are caused by a minority of causes. That's what we're seeing here. So this disease isn't seeping homogeneously through the population. It's exploding in punctuated occasions. It's like, the old Breck, I think it was a Breck commercial, the shampoo commercial, I told two friends and they told two friends and they told two friends and so on and so on, if you're old enough to remember that commercial. Well, this is more like I told two friends, one friend didn't tell anybody, but the other friend told 5 people, and of those 5 people, 4 didn't tell anybody, but that 5th friend told 6 other people. So it's spreading in a, again, explosive, punctuated fashion, and we call this the super spreader phenomenon. That's what we're learning here, and it's unlike some other exponential growth experiences in that way.
And Ashley, why is it important for us to know how this disease spreads?
So I think Raywad explained that very well. So when we initially realized what COVID was and we're trying to characterize it, one of the first things that scientists talked about was something called the reproduction number. And that's the average number of new cases each old case causes. And for COVID-19, we think it's between 2 and 3. But we've learned that it's really, really variable. And so some people will infect a lot of people, and a lot of cases will go on to transmit to nobody or to just 1 or 2 other people. And that variability and understanding it is really important because it allows us to think about, how do we control it and how do we intervene in a way that captures the fact that a lot of cases are not going to transmit to a lot of people. And that, if we can understand this clustering of cases and how it transmits, we can potentially control this in a way that doesn't require these broad lockdowns and very sort of population-wide interventions that can be incredibly disruptive.
Since the pandemic began, we've been looking at the measure of how contagious this disease is on average, known as the R0. Does that measure tell the full story of how this disease spreads, Ashley?
No, it doesn't. And so that's where this overdispersion comes in. And what that really means is it's a measure of sort of that heterogeneity. So it's a measure of the fact that most people are not going to transmit to a lot of people. And for the case of COVID-19, we know that this overdispersion the number for the overdispersion is low. And what that means is that a small number of people are responsible for large amounts of transmission. And so when we talk about averages, which is what that basic reproduction number is, it doesn't capture that heterogeneity. And again, that's an important feature of the disease. And it's something that's quite different from flu. So flu is a disease that, has a reproduction number of, again, between probably 1.5 and 2. But it looks different than COVID-19 because most people transmit to 1 or 2 people, and we don't have these super spreader types of events.
And how important is that to know? Because we've been hearing a lot about a potential twindemic with COVID-19 and the seasonal flu. How important is that to distinguish that now?
I think the important thing is really when we talk about interventions and we think about how we control this, The way that we responded in the spring was really based on the assumption that when we had a pandemic disease, it was going to look a lot like the flu. So all of our pandemic plans are based on that. And we've learned over the course of the past several months that this isn't the flu, that this we can basically leverage this patchiness and this clustering, and we can use that information to better control this and to think about interventions that address this clustering and this patchiness. And again, we have to think a little bit differently. We can't just treat this the same as the flu.
And Raywatt, has this understanding of super spreaders worked its way into how we understand COVID-19?
In a sense, what do we know now that we didn't know back in the spring? We know some things clinically. I'm not a clinician, but I'm told by my clinician friends we know better how to treat it at the hospital level. We know how it affects our biologies a little bit better. But epidemiologically, we understand it's a super spreading kind of thing. So as Ashley eloquently put it, now we know which levers to pull at a policy level, at a control level, at a public health level. And that's critical, because that means we have a path forward towards something resembling normality, absent a vaccine or a therapy.
I want to read an excerpt from on how Japan approached COVID-19, and this was in the Atlantic magazine. And they write, Hiroshi Oshitani, a member of the National COVID-19 Cluster Task Force, likens his country's approach to looking at a forest and trying to find the clusters, not the trees. Meanwhile, he believes the Western world was getting distracted by the trees and got lost among them. Raywatt, have we here in Canada been too focused on individual infections versus clusters of infections?
Absolutely, yeah. And South Korea is a great example of this. They have a fantastic system. I mean, it's a really robust, complicated, comprehensive system using all kinds of tools for contact tracing, including tracking credit card usage for understanding where people have been recently, using cell phone data to track mobility and so forth. They also have a QR code system where if you go into a business or a nightclub or a bar or something or a shop, you have to scan the QR code, and that creates an electronic log that you have been there. And that's kept for about 4 weeks. So in case there is an outbreak, we can figure out all the people who are likely part of that clustering event. So here in the West, we do forward contact tracing. That's where you identify someone who's infected and then figure out who they then came into contact with after they became infected. And that you get, a fair number of cases that way. But if you can go backwards and figure out where that first person got infected in the first place, they were probably part of a cluster. So we identify that cluster and then see other people in that cluster and follow them. So there was a fairly important paper by Endo, I think it was, at LSHTM, that suggested that using forward contact tracing more robustly and just identifying more contacts, you can increase your case count by 15%, the number of people that you catch. But backward contact tracing, going backwards and finding the original cluster, you can increase the number of infectious cases you identify by 2 or 3 times. That's huge. That's an enormous policy lever, and probably why some Asian countries who do this are able to, again, have a kind of pseudo-normality that we have yet to acquire. But it does come as a cost. And I mentioned that there are some privacy issues there. You have to have a compliant population that participates in this endeavor. We have to agree to use the QR codes. We have to agree to be tracked. And also you need a really good testing system, because you have to test these people once you find them quickly enough to prevent them from spreading on further, and a strong isolation procedure as well. So it requires a rethinking of our infrastructure overall.
And just to go on what you were talking about with the backwards contact tracing, Ashley, can you give us a definition? What is backward contact tracing?
So basically, it's turning contact tracing a little bit on its head. So the way that we typically do contact tracing is, again, exactly as Raywatt just described, is you start with your initial case that you find via testing, and you ask them who they've been in touch with, up to 2 days before they had symptoms and over the time during which they were infectious. And you find those people who are contacts, and you isolate them, and you get them tested. And basically what you're trying to do is interrupt these chains of transmission. With backward tracing, what we're saying is when we have that initial index case, we want to know, was that person the contact of a case that we've already identified? And if not, how did that person get infected? So what we do is we look backwards for a longer period in time, and we try to identify, where that person was, what was the most likely place that they were exposed at. And then once we find that potential exposure event, we sort of identify people who were also at that venue or associated with a particular activity, and we do forward tracing. So you basically are doing this sort of backwards and forward dance, but the idea is to really look backwards in time to find those risky activities, risky venues, so that you find more cases. And the idea is that you just get a higher yield because this disease clusters so much. Once you have an initial case, it's highly likely that they're associated with a larger cluster. And if you're able to look back in time and do this backwards contact tracing, you could potentially find more cases and interrupt more chains of transmission.
I was actually going to say that I guess what we're doing here in the province is forward contact tracing, but Ashley, you did say that. So I want to ask you both, do we need to change how we do contact tracing in this province? Raywat, I'll go to you first.
Yes, absolutely. If a vaccine is months away, if not years away, and we haven't got a treatment yet, and we want to avoid economic closures, I think there are lessons to be learned from Asian countries who seem to handle this better than we do. And of course, they have other cultural differences that make it possible for them to do this. But yeah, I think if we really strengthen our TTI, or testing, tracing, and isolation regime, we have a really good chance of having a better handle on this. That means backwards contact tracing. It means hiring more contact tracers. It means empowering them to do things that currently they cannot do, like using electronic data for tracking and so forth, maybe even social media crawling. And it means investing in more testing capacity for that faster turnaround once you find cases. Yeah, I think this is how we have to do this going forward.
And Ashley?
Yeah, no, I agree 100%. I think the one thing that's important to note is that backward contact tracing is really, really effective when you don't have large numbers of cases. So it's most effective, early on in the epidemic when it's starting to grow. And again, towards the tail of an epidemic or the tail of an epidemic curve, when case counts are low again. When you're in the midst of high number of cases, which is where we are in Ontario right now, and where we're struggling to keep up with even basic contact tracing, the effectiveness is going to be harder. And so, I have a lot of respect for people who are doing contact tracing right now because, their jobs are incredibly difficult. So I do think that there's huge value in doing backward contact tracing, but we also need to be cognizant of the workload that's involved. And again, provide, I think, innovations in terms of, how do we do this? How do we support the people who are doing contact tracing? And also, I think the other component of that test, trace, isolate is support. We absolutely, I don't think we have enough conversations about this in terms of, when people are identified as cases or when they're identified as contacts, we really need to make sure that they have the supports that they need to be able to self-isolate and be able to adhere to all of the recommendations that we're suggesting.
Kind of like having a place to stay for quarantine, et cetera. I know
Exactly.
I know some people are listening to this, and there's a lot of frustration all around because we do know that right now we're using a contact exposure tracing app, and in the past few days we know that not many people are using it. So do you see, if we are to take on the backwards contact tracing, do you worry that that's going to add on another layer of confusion around this whole COVID-19 situation, Raywat?
It's possible, absolutely. And messaging around this pandemic has been a problem from the start. Getting buy-in from the public has been an issue. Getting clarity in what we expect from people has been an issue as well. But this is the nature of our game. We're in chaotic times and unprecedented times. But again, what we see from places like South Korea and Singapore and Japan is that the QR code system seems to be easier for people to handle because they take out their mobile phones and they scan the QR code at the entrance of a place, and they're done. But that requires people to have a phone with the appropriate technology attached to it, and it requires people to actually do the thing we ask of them. So public compliance is very important. And I hope going forward that we make investments in assuaging people's concerns and getting the citizens on board as partners in this endeavor. This can't be done from a top-down process alone. It needs buy-in from the people and leadership from the people as well. This is a democratic process. Pandemic control is a democratic process.
Well, when we talk about super spreaders, do we know how that happens, Raywat?
Wow, that's a good question. I think about the Swiss cheese model. Different slices of cheese have different holes in them, and you need all the slices to line up just right to get like a hole right through. So you need several things to line up just right for a super spreading event to occur. And these include characteristics of the virus, characteristics of the virus interacting with the infected individual, and most importantly, in my opinion, characteristics of the environment. So is the infection upper respiratory or lower respiratory? How far along the infection disease cycle is the individual? Are they symptomatic or non-symptomatic? Are people around them resilient? Are they older or younger? And the environment. So is it a crowded place? Are people wearing masks? Is there alcohol involved to reduce the ability of people to make rational choices? Is there good ventilation? So all these things matter, but they're happening so frequently that by chance alone the cheese slices line up more frequently than you think, and that's how we get these super spreading events. So we never know which event is going to be a super spreading event, but we have a good idea of the environments that are amenable to super spreading occasions, and that's a good thing. It means we can identify those likely scenarios and take them off the table in times of caseload increase, as we've done in Ontario recently. I think closing some businesses was a wise thing to do because those are likely super spreading opportunities.
And Ashley, are some individuals super emitters of the virus?
Yeah, so again, it's a complicated question. I have a colleague, David Fissman, who refers to super spreader events as the Lemony Snicket series of unfortunate events that leads to a super spreader event, because it's a combination of the individual. Over the course of an infection, people emit different levels of virus. So people tend to be most infectious around the time that they develop symptoms. So if you happen to be out at that particular time, you're more likely to transmit than at another stage in your infection. Similarly, different people have different viral loads. So some people are more infectious than others. But again, the other sort of piece that goes into this is the environment. So where are you? If you're staying home, even if you're generating large amounts of viruses, if you're not seeing other people, you can't really have a super spreader event. So again, it's really this confluence of various factors that's really important for generating super spreader events.
And obviously not to make light of it, but like a series of unfortunate events in a way.
Exactly. So you sort of have to be at your peak of infectiousness, and you happen to be out at a restaurant that has poor ventilation, and you happen to be in close contact with a lot of people, or the air conditioning is blowing in a way that you cough and your virus particles are spreading into a bunch of other people. It's really, these series of circumstances that, some of which we can control, but some of which we can't necessarily predict ahead of time.
And what about kids? Are kids super spreaders of the virus?
That is the controversial question that will get us both into trouble, depending upon who's listening to this. Some people say no, and some people say yes. I say yes, they are. And Ashley actually tweeted a study just recently from SFU that found that most kids, when they're infectious, do not cause clusters, but some do. And the problem with those that do is kids are more likely to be asymptomatic. So they're stealth infectors. And these stealth infection events can cause clusters that are more difficult to detect. And you start out the show by citing this India study that looked at 3 million people, and they found that children who are infected have just as many first-order infected contacts as adults. So kids and adults have equal proportions of infectivity and equal likelihood of infecting others. And now we have kids in schools all over the world. Now, the good news is that the number of school outbreaks is probably less than some people expect. It's not the apocalyptic event that some had projected. However, school outbreaks are happening. In the UK, they've had scores of school outbreaks. In France, there are more outbreaks in educational settings than there are in workplace settings. So yeah, the answer is yes. Kids can be super spreaders, in my opinion.
I'm sorry, I didn't mean for it to be a controversial question because, kids haven't been in school for a very long time, and, kids are going to school. So I'm surprised it is a controversial one. But so Ashley, are kids super spreaders?
So I'm going to hedge this a bit and say, I'm not really comfortable with calling children super spreaders. I would say children are associated with super spreader type events.
Okay.
So we know that children can get infected. We know that children can transmit the virus. And we have growing evidence of super spreader events happening in schools. But again, it's that combination of children are infectious, they can be infected with the virus. I think the biggest challenge is that they can be infected and be asymptomatic, so we don't necessarily know it. And again, schools are an example of a really good environment for spreading COVID-19. We have closed spaces with poor ventilation. You have lots of people together in a crowded space. In the absence of masks and in the absence of physical distancing, you have a lot of people who are talking often very close to each other. So again, I think schools are absolutely showing to be environments where super spreading can event. And so, yeah, or super spreaders events can happen. So, yeah, I would say kids are associated with super spreader events. I hesitate to call children super spreaders because I don't think there's something unique about children that makes them transmit the virus.
It's the environment
than other people.
So it's the environment. I think, again, we've talked about messaging and, people, we've talked about what's happening in Ontario, about the class sizes being bigger than what scientists have suggested. But we've had that conversation already. So Ashley, for the average person trying to go about their day, heading to the grocery store, maybe even considering going to the mall, using public transit, what does our understanding of super spreading mean for the level of risk that they should feel?
So I think one of the challenges with the idea of super spreading events is, on the one hand, it's a little bit reassuring. You hear this and you say, well, most people are not going to infect anybody or they're not going to infect a lot of people. But the challenge is we don't know ahead of time who those people are and what the circumstances are. So I don't think that we should go about our lives necessarily feeling more comforted. I think, though, given what we know about the sorts of activities and environments that facilitate super spreading, I think we can use that to guide our day-to-day activities. So the Japanese have what they call the 3 Cs, which are closed spaces, so indoors, crowded places, and close contact settings. So settings where people are close together, talking and singing. And I think that can really help you guide your day-to-day activities. So, if you're going out to a grocery store, you're wearing a mask, you're keeping your distance from other people, you're not spending a lot of time indoors, that's not a high risk interaction. By contrast, having 10 of your closest friends over to your house and, doing karaoke is a high risk because you have lots of people indoors, you're singing. And so, thinking about those different factors and understanding that those 3 Cs can really sort of help us predict the sorts of environments that are higher risk. I think that can help us sort of navigate our lives, recognizing that, we can't all stay indoors forever and we need to go out and we need to live our lives.
And Raywad, I'll ask you the same question.
Yeah, it doesn't change what individuals have to do. We have to keep our distance from people, wear a mask when we can't keep our distance from people when we're indoors, and avoid social gatherings we don't need to go to. Now, individuals may be called upon in the future to participate in these backward tracing endeavors, meaning using QR codes and so forth. So that's where citizens can do their part. But the super spreading thing, I think, has more relevance for managers at the public health level to allow us to figure out which opportunities to take off of the table at a societal level. So again, for people, the average citizen, just keep your distance and avoid social gatherings.
And I want to go back to that when we're talking about clusters. We know that there's been a lot of cases in congregate settings. We're talking about schools. We're talking about long-term care homes. Ashley, could we test wastewater to help detect clusters of infections?
Yeah, I think that the wastewater stuff is turning out to be a really effective tool right now. So Ottawa's started using it. I think other parts of the province are starting to use it. And it shows that it does track what's happening in the community. So I do think, particularly in congregate settings like in long-term care homes and in schools, there's huge potential for this as another way to basically get a handle on what's happening, rather than simply relying on reported cases, which, have become clear are really, really challenging to interpret as we start changing our testing policies. So I do think it's a really important stream of data. Having said that, I think we're still trying to figure out exactly how to interpret it and what some of the nuances are in terms of how to act on that information. But I do think there's a lot of emerging evidence that it is an effective tool.
Raywat, I'm going to end with a big question. We only have about 30 seconds. But to what extent is COVID-19 still a bit of a mystery to us?
Oh, well, it's a huge mystery. We still don't know where it came from, really. I mean, to some extent, I'm hearing rumors that there's evidence that may have been with us longer than we thought, like by weeks or possibly months. We don't know its effects physiologically as well as we could or should, and we don't know about immunity. And that's relevant for developing a vaccine. But epidemiologically, we're getting a handle on transmission dynamics, which is really good.
And Ashley and Raywat, that's all the time we have for now. Thank you so much for your insight. And Raywat, I know you've been on this show before, and Ashley, just wanted to say you were terrific. Hopefully you'll come back on the show.
Thank you so much.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.